So we're going to be talking about polycoria. Coria means pupil, like isocoria or anisocoria, not the same size pupil. And poly just means many. So there's two types of the polycoria. One is when you actually have two separate and distinct pupils, and each of these little pupils has its own sphincter. So it's a real pupil, but there's two of them. Polycoria, that's the true version of it. But most cases of polycoria are actually pseudo-polycoria. They're pseudo because they don't actually have a sphincter. It's an iris that has had an iridotomy blasted into it with a laser, or surgical iridectomy. Or they had trauma and you have iris atrophy and you have a hole in your iris. So when you have iris damage, either surgical or traumatic, or you're born with it, those are probably pseudo-polycorias because they each don't have an independent sphincter. And the reason it comes to neuro-op is when you have two sources of light coming in, you'll get diplopia. But that diplopia is a monocular diplopia, not a binocular, because it's just two light sources hitting the retina. The way to differentiate it is to block the other holes and put a pinhole on. So some patients with diplopia have monocular diplopia. If it's monocular, you're going to look with the slit lamp for true, super rare, and pseudo, kind of common, polycoria. The treatment, block the other pupils, and that means putting a contact lens on there that's block the light and only allows the center to come through. Not really.